All right, hope you're having yourself a beautiful Thursday evening. Hello and welcome to Tipping Point. My name is Nick Mudimba. It's a period no one wants to sit or maybe stand next to another. Of course, you know very well the coronavirus effect is taking a toll in this country. And as you know, the country is on a forced curfew. As you know very well, it's from 7 p.m. to 5 a.m. But it's a period where also so many people will have to part ways with their employers, will have to part ways with at least some figures in their gross or that is the salaries. And it's a period also I can add that the government is also trying to cushion and just to fill in the blanks that Kenyans might be feeling. I'm not alone in studio today, and of course, it's a period I can say we want to touch base on so many issues affecting even the young people, so many issues affecting our country, and it's something that I must say, not all of us are ready for COVID-19. And the talks of a lockdown is actually here. And when you talk about even people coming in to bring out their feelings on how these things are going on, sometimes even the government isn't so much clear. But again, today we want to discuss all that right here on Tipping Point. And I'm joined by actually two young, this lady and gentleman in studio. And it's something that I'm proud to associate myself with because now we have George Gibore, who's the Secretary General of KUSO, and of course Hadija Galgalo, who is the ANC youth leader. And we sit here, it's very evident that the distance is actually very, I can say, when George, you're too far from me, which is very safe. Hadija, too far from me, which is very safe. So your concerns back at home, I must assure you that we are safe here in studio. But let me start with you, Hadija. How have you been, maybe to say this period? How have you been yourself?
Myself, I can say I am well 100%, especially with what is happening currently in the country, where there is this curfew thing that you need to be indoors, and every time you stay at home, so most of your errands, you can't run your errands. And if you have to run your errands, you have to keep to time.
Absolutely.
So which is a bit challenging. Yeah.
Bwana George,
Yes.
we'll see you today. So this period, curfew, the tension, as a clinical officer, one of you was infected with COVID-19, right now recovering. What's this season like for you?
Thank you very much for having me. And I need to say that we are in a war. This is a war which was brought to us before we are prepared. Similarly, across the world, no one was prepared for this. And our aggressors, who is our enemy, the tactics they is using is one thing that we are learning on the process, so that we can be able to tackle and actually ensure that we are responding. And that's why you see we have very many cases, and we have also deaths registered across the world. And there's something that now we as the health workers, what we are doing is to ensure that we want to do what we can by the support of the Kenyan government and the people we are serving. We ensure that we can be able to offer services which is required to save life, as many lives as we can. Because as it is currently, we have now 80 plus cases in the country, and we have a one death case registered.
Absolutely.
So that one tells you that as it is, we need maybe to check on the system whether we are doing right, because the good thing with us is that there are other countries which have actually gone through the same process before us, so we need to learn from the same. So we, as you have said, I'm the General Secretary for the Kenya Union of Clinical Officers, and similarly, we are the frontline health care workers. As you have said, one of us also contracted this virus, was quite unfortunate on the line of duty. And she's now admitted in Mbagathi, but of which we feel that it is not right, because we have said that the health workers need to be considered, to be given priority, not to be mixed together with the other patient. It is like the soldiers, our soldiers, when they are in fighting, they are segregated away from other people. So the Kenyan citizen need to appreciate that these are the people they expect. Once they are out of that situation, they will still come back to serve. So you don't have to stigmatize them. As it is, also the husband tested positive. We are looking forward also that the children and the house help can be tested so that we get to know the situation.
Absolutely.
So as it is, but for the health workers, this is one of the things we expect because we are now in the fight.
Yes.
We know that some of us will be infected on line of duty, but we will not just say that we have now, one of us has been infected, then we run away. What we are saying is that we need to do the right thing. We are now learning from what has happened. We now know that the government has not fully trained the health workers. It has not provided them with the recommended PPE, that's the personal protective equipment. So this is what we are actually pushing, that the government need to do and actually treat it as an utmost urgent thing to do. As the government say they have enough money, I think they need to focus on that. Yeah.
All right, interesting. So just a few days ago when the government came up with the curfew, we saw police brutality on a different level. Mombasa, we had a journalist who was assaulted. And let's just take a listen and, of course, a look at a story we had for you earlier about the brutality that went down on day one. Take a look. Adija, looking at this situation right now, day one was catastrophic. And what's your opinion on this on day one?
First, I would like to condemn the act of the police. I mean, the work of the police is to protect Kenyans and not to subject them to any sort of brutality like we have seen. And in this case, this police needs to be charged in court because they need to be asked why they actually had to go all this, to go and do all these things of beating people and even causing a death, to the extent of causing a death. Their work is to protect Kenyans and not to subject them to brutality. And for police case, I think they actually went overboard in terms of their job because this curfew has been introduced and is the first time. The good thing they could have done is to maybe look at how well that could have been handled, given that a place like Likoni, we have a ferry that used to carry a large number of people in a particular time. But with this social distance, now the number has been reduced to like 400 people, and it used to carry like 2,000. So of course, with that one, it will have to take a lot of time for these people to just move from one place to another.
Absolutely.
So I think the government could have been considerate as they were putting this curfew on board. They could have also looked at other things that could have come with it. Like a place like Likoni is not like Nairobi here. You know, so there was a difference. They could have looked at it in a way that this is Mombasa, this is Nairobi. How are we going to handle different sectors in terms of how they operate? To me, I first condemn the police and they should be charged with what they actually did. Especially looking at someone, the case of the Kia Michael, a 14-year boy being shot in the balcony, not even outside. I mean, they went overboard.
Absolutely. All right. Bwana George, looking at the whole scenario, day one, because psychologically they're saying they were instilling fear on Kenyans, because now after that they kind of toned down, and day one was very bad. You saw very many injuries, and we saw also Kenyans complaining, the president apologizing later, which we'll listen to in a bit. But looking at day one, and of course the ongoing situation, what's your opinion on this?
I think my opinion on this issue is we need to get to understand that we know our police were police force. Then we moved to police service. Now we still have people who are still the police in the police force, where you used to the force to enforce the law. Now, because they are enforcers of the law, I think what they did was very wrong, and they must not be accepted in the current time. And of course, the officers individually must actually be taken, must take responsibility individually. And also, because we know how the law works, if they did not have the order to use, even including bullets, how do you use live bullet? You could see even the women stepping out of the car, they are being beaten. And the guy with the Aroli reports that I have food stuff.
Yeah.
They have not checked whether there is any food stuff.
Wow, wow.
They are raining on him. Their interest was actually to beat him. So that's what they did, and they let him go.
Okay.
And I need to say that before then, the government had actually gazetted services that was to be excluded from being actually under the curfew line. So, which include the health services, those who are offering the health services, the security, food staff, and also pharmacists, and including also now the hotels, and also some of the registered, I think, supermarkets.
Yes.
So the police ought to have actually been informed that these are people to be exempted even when we are enforcing the law.
Yes.
And even when enforcing the law, we must observe the law. You must not take the law to yourself and actually ensure that you are actually overstepping what you have been provided.
Yes.
The last thing I needed to say is that this was the first day and it was expected. You know, people were out, all of them, and a majority of us use public means.
Yes.
The public means is the one that we depend on for us to move around. A majority, actually over 7% of Kenyans. So when you know that it has been interrupted, it was actually expected that this was to happen.
Yes.
So the police was actually to assist people to ensure that they are now adhering to the new order, not actually to galvanize and push people together, actually not forgetting that we have recommended the social distancing. Now you could see them clamping people together, putting people together, and even themselves, they are actually clamping together.
Wow.
So they were not observing any order in any case.
All right. Now, all that happened and the president came out to apologize to Kenyans that indeed it was wrong. Let's just take a listen to what he had to say.
I know, especially when we introduced the curfew, maybe in the initial stages there were some challenges, and I want to apologize to all Kenyans, maybe for some excesses that were conducted or happened.
Well, he apologized, and so many Kenyans didn't take it lightly because now he would have been the first person to tell the security bodies to take it slow. But again, he apologized. It's good, yes, but he knew what happened. Now, you've been a youth leader for quite some time, and most people who suffered were young people who are trying to get matatus back home. But looking at the apology, it's clear something wrong happened. In the back of your mind, do you think this could have been prevented earlier or not?
Of course, yes, it could have been prevented earlier, sorry. And first of all, I will want to say it was a good move by the president to apologize. But again, you've not even given us the solution to the problem. You've not even come out and tell us that now this is what happened and this is the solution now going forward.
Yeah.
You've not given us the way forward. Look at someone, you're coming out to apologize, but for someone who has lost a kid, someone who has lost a family members, how do they feel at this particular time? A sorry alone will not help them. They need to take care of burial things, and here is another curfew thing, and then there's a lot to be put into account. So to me, the president could have prevented this by looking at it in a very different perspective of, yes, we want to save this country out of this COVID-19, but we also need to look at the measures that you're putting in place so as to avoid this thing from reoccurring. Again, by the time the president was introducing curfew, I think the first thing is that president could have liaised with the CS for security in order to know how they're going to handle these things in different counties, depending that we have like 47 counties. They could have now said, we need to know that we are dealing with a certain number of people in every county, and how well can we manage this without using force. And in terms of like, yes, there is curfew, when that time comes and you are like, the people are not at home, it's also good for the police. They could have slowed down and get to understand, is it because of transport challenge? Some of them, they are employed. Probably their employee had did not release them early, and you have to comply when you're employed. You want to you need that job, so you will actually just follow what your boss tells you. So they should have put all that into account. Later on is when now we hear now them telling the release your workers early as 4. This could have been done earlier, not wait until the damage has happened.
Absolutely.
That is when now you're coming
Absolutely.
back.
It's clear, George, there's some communication gap over there. Looking at the sequence of communication, yes, there's a curfew, but there was no organizational kind of a background, because we saw so many people suffering. In fact, people were even fearing food stuff. They suffered in that night. But looking at the way the government is communicating, are you satisfied?
I think let me start from where the president has come out to admit. I want to call it his admission of what the police did.
Yeah.
As much as, yes, he has apologized, I want to say that we have lost life. 3 young people have lost life. So this is, yes, he apologized, I call it is good, but too little, too late. Because we will not wake up these people to come and continue with their life. You could see the young family, the way they're crying. This could be their firstborn. They are looking with a lot of hope into these young people.
Yeah.
So there are people who are totally being relied upon to provide some bread for their family. They are no longer there. There are some people, maybe we are not being told, those who have been actually maybe they are suffering in their own rooms with injuries, which we are not being told.
Yes.
But we are now highlighting the few cases that. So the president need to tell us how they are going to caution the family of these people, not just telling us, apologize. Yes. So does we bury the whole thing? We are fighting corona, and you come cause more harm to Kenyan, when we know that we have 1 case, which 1 death for corona, you even move further, increasing the numbers. I don't think that is acceptable. And we need to be a country that observes the law. If the government is wrong, must take responsibility. If it was a Kenyan who was wrong, they will have taken responsibility. The government will be on their toes. Look at how they are gagging people from speaking.
Yes.
So when you speak anything they don't believe in, these people could be checking on what the government is doing, but they don't want to be checked on. We want them to take responsibility, let the family be cautioned from what has happened. Yes, we know it will not bring their life back, but let them take responsibility.
Absolutely. So, Hadija, before we take a break, when he says taking responsibility, that means there need to be some accountability also in this situation. Now, looking at even the people who are trying to travel long distances, are you in support? Because now there's curfew. Maybe you have estimated you're leaving Nairobi to Marsabit, or maybe Nairobi to Mombasa at this time, and then you're caught in an emergency somewhere, and then you get past 7 p.m. And so many people are experiencing that right now. So do you think they need, but by explaining themselves, won't really give them that mercy from the cops? But do you think the cops should also have that listening angle? So some of them do not listen, actually. They just take action on you right away.
I think from the cop side, they need to develop that listening skills, and they need to understand that most of these people are using public means, and they are not using like their own car. Those are two different things. You can't subject someone who wants to travel and tell them, you need to be there by 7. It's not upon them. This is a transport that you're using. There's a driver who will maybe decide, I want to leave Nairobi at this particular time. So in that case, they need, the police and the cops need to understand that these people have traveled and probably they are late. And for me, the curfew thing is not the solution to the problem we are facing right now. I mean, lockdown is the only thing that will help. And for people who are traveling, I mean, it's not the right time to travel. It's not like you're going for Christmas holidays or something. People should need to know that even if you're traveling, you're even going to cause more damage. Because the people who are there are old people who are like to succumb to this disease, especially when they get it, as opposed to a young person like me. My immune is still strong. It can fight back the disease. But now you're going back and you're going to up country, you're going to even kill more people, transmit those diseases to more and more people. So that is not a solution, and I think people should remain where they are, and they should stop traveling at this particular time.
All right, so we're now taking a short break right on Tipping Point, but you can be part of this conversation by sending your SMSs to 22999, and I'll be sampling some of them right in studio. So up next, we want to talk about lockdown. What does it mean to be locked down? I'll just give you a clue. It's no leaving the house. What will be the impact if that lockdown comes through? All we're coming to you after a short break. All right, welcome back to Tipping Point. Yes, before we took a break, I mentioned the issue of lockdown, and not so many people understand what lockdown means. Now, South Africa, Uganda, and neighboring Rwanda are doing just that. And it's actually a minimum of 14 days and maximum of 21 days. So that means you're not leaving the house and so many other things. You won't be enjoying your freedom. Curfew is just a tip of the iceberg. But again, George, looking at the lockdown, because now so many Kenyans are talking about the lockdown to control all these things. And the issue about only those recently infected, yesterday we talked about the only people infected were in the quarantine areas. But is it safer to say we need to introduce lockdown to actually manage this virus?
Thank you. You know, I can see your program is Tipping Point.
Tipping Point, yeah, sure.
We have to speak the truth
Absolutely.
and tell Kenyan what is
Absolutely.
supposed to be done.
Sure.
One, we are health workers. In any case, the frontline health workers.
Yes.
When the COVID-19 started, we were importing cases coming to this country. So majority of the cases, and actually a majority of which we still have, are still imported cases. But it is now clear, including under the infection where we have now one of the health workers infected on a line of duty, it has shifted from importation because we stopped flight.
Yes.
Now we are incubating the disease here with us. So indeed, the cabinet secretary has confirmed that this case is now touching the whole of Nairobi.
Yes.
Now, we have actually gone further to highlight and tell Kenyans that we have several counties which is now high risk. Nairobi, Kilifi, Mombasa, Kwale, and Kajiado.
Yes.
What we need to encourage the government, we have called for curfew. We need to assess anything you are doing to ensure that we are able to cap the spread of this disease. We need to assess, and it must be within the time.
Okay.
We need to look at it. When we say that there is a curfew, at night, yes, we reduce movement. What happened daytime? The people you want not to move at night, they are moving from Nairobi to other counties. So what happened overnight? What movement? Yes, we slowed the movement at night.
Yes.
But there is rampant movement during daytime. Yes. I overheard, and actually on Monday we raised this issue. And we said, we had even done our proposal as the union, like the Kenya Union of Clinical Officers, we have done a proposal and said the government need to be candid and consider lockdown for the high risk places like Nairobi and other counties. Because one, if we don't do it in the next few months, because you have had the AG said and they gave actually a projection on the numbers we expect from time to time. So do we wait for this number to grow for us to take measures like lockdown?
Okay.
Will it be so costly than now taking a lockdown when we still have few cases and with at least selective places?
Yes.
Because at the end of the day, if we don't do it, when the number grow, we will still be forced to do it, and we will do it across the country, and it will be more costly than even when we can be able to do it. Remember, our two biggest city which contribute to our economy, now that's Mombasa and Nairobi, is now locked. With the now being the high risk. Yes.
All right. Now, Adija, lockdown is easier said than done. Looking at the situation, not so many Kenyans understand. You know, a curfew will just be maybe for a few hours. I think they've also been giving us time to sleep. Then 5 a.m., you're off to your own hassles. But looking at a lockdown, you're indoors full time. You're not leaving. You must make sure you have shopped enough. But not so many Kenyans have the muscle to shop enough and feed their families. They have to go out and hustle. What do you think about lockdown?
For the lockdown, I think, one, it's one of the best measures that can help the country curb the COVID-19. But at the same time, we can't just wake up and say lockdown.
Yeah.
Government has to put a measure in how it's going to handle these people who comes from different areas like slums, who cannot feed themselves. We have street children who cannot even afford that water we are being told about, who cannot afford sanitizers. So I think, to me, the first thing will be that the government need to come with a proper mechanism in terms of how they're going to feed the Kenyans. And right now they are telling us that they have the money.
Yes.
Now, we have seen a pay cut from the president to the deputy to the ministries contributing, and central bank has given out some money. They have said even the 10 billion, I think they were to use in the BBI, they will also put in an emergency fund, and some money that was supposed to be for the development also have gone to the emergency fund.
Okay.
Now, all this money has to be put together, and they need to know how best can we help the Kenyans. Because at the end of it, most of the Kenyans are surviving from hand to mouth.
Yes.
I have to go out to get something for me to come and feed my family.
Yes.
And that is why we can hear some people saying, afadhali nikufe na corona kuliko kukufa njaa. So the government should have to put all this into account, because you cannot lock and force people to stay indoors, and yet they have no food.
Okay.
Because they are still going to die because they are not feeding themselves or even their family. So for me, the government needs to now come up with a proper measure and look at which areas that we have people who cannot, because of course we have other good Samaritans who can come in and support the government when it comes to food. And then once they are able to provide that, there's also an aspect of water. We don't have water.
Yes.
And right now, we are being told, wash your hands, wash your hands.
Yes,
it
absolutely.
becomes very challenging, especially even maintaining social distance is a bit challenging. In places like Kibera, Mkuruanjenga, those where there are slums,
Absolutely.
people are not maintaining, because I live here, you live here, we're just living next to each other.
Yeah.
Before I pass my door, I have to touch your door and touch other person's door so that I can. So to me, government needs to come up with a proper measure before they come even up with a lockdown thing, so that every Kenyan who will be in their house will know, so I have a food, even if it's going to sustain me for 2 weeks,
Yes.
but I have something at least that I'll rely on for the meantime, so that now government can be able to also contain this disease before it spreads. Because yesterday we saw the 22 cases. It actually doubled from the previous days
the
that you've
highest,
been
actually.
like 8, but right
1,
now,
2,
yeah, you're telling us the projection is about 10,000, which
End of
again
April,
is
that
not very clear. Now, how prepared are we? As we are talking about the lockdown, the governors went ahead even to say, even them, they feel we are not ready 100%.
Absolutely.
Out of all the counties that we have in this Kenya, only 22 counties have ICU.
Wow.
And the beds that are in those ICUs are only 162. Now, with even 10,000 people, you're telling us, which you are not even sure, because right now the manner in which the COVID-19 is spreading is just something that is beyond the control right now, because those people have mingled with others and they have families. So we need to contain it as early as possible. Yes, lockdown will be the best solution to contain this, but we need to look at what are the measures to put in place before we implement it.
Absolutely. So back to you, Bani George. As a medic, these are very worrying kind of suggestions and very worrying facts, because now we talk about the preparedness. The counties are also not well prepared, and you saw the CS, that is CS for Health, Kagwe, saying that some counties have been affected, but they are in Nairobi. That psychological preparing these counties for anything. But as a medic, you know, you're the frontliners. Let's talk about you guys, because now you're the people who are attending to these patients directly. At some point, so many of you went on strike, complaining about lack of the PPEs, and it's something that is also worrying to even to their families. You can imagine a medic leaves the hospital, goes back to the house. As you mentioned, your colleague infected the husband. The house girl and the kid will be tested in a few. But you as health workers, what have you done to push the government just to make sure you're sorted? Because I had a conversation with the clinical officer in Migori. She tells me there's nothing. There's nothing they're wearing. There's nothing. They actually, most of them prefer to leave the hospitals earlier to go home.
Thank you. We started by trying to say that no country was ready for the coronavirus. And that is why you have seen, even when we announced mask can assist, people went around and we had stock peeling and others were not able to get. And actually, we exhausted some of those, like the sanitizers and the mask from the market. Then we had to organize on how to do that, to bring them on the market. Now, look, when you talk about it, let me correct it, because maybe she interchanged it. We have 24 counties
Okay.
with active at least ICU, which have ICU functional.
But how many beds now? That's the question.
Around 162.
Will they be
total
sustainable? Will they be
together.
sustainable? Like, you know, when the patients
162 is
Yeah.
very little. If you project to have 10,000
10,000.
In the next month, people, because we might have very serious patient,
Yeah.
and subsequently now you need to get to understand that to have a ripple effect
Yes.
with a number of other things. Now let's talk about the health workers. Currently, we want to be very specific. We have put it to the government. We do not have enough staff. And even the fewer staff we have, they have not been trained adequately to feel comfortable and competent to address the menace that we have.
Yes.
2, we have not supplied them with the recommended personal protective equipment. 3, we are exposing all of these patients, all of this staff at the same time. Look at what happened in one of our facilities, which is in Ngara. It has been highlighted.
Yeah.
One of us got infected, and she was still serving patient and meeting, mingling with the staff. All the other staff had to be taken for quarantine. She is taken for isolation.
Yes.
Now, the facility had to be closed down because all the staff had been exposed.
Yes.
We are saying the government need to come out and put the strategy to ensure that, like facility, we can have a half of the staff serving for 14 days. Then when they are out, we bring the other staff. Because if one of maybe that cluster or rather the group is affected, we can now evacuate the other one as they are going for quarantine. We have the other one running the facility. It has an implication when you close down the facility, which people believe they are coming to seek services, and you tell them there was corona here, and you are spraying during daytime. The people will fear to come even to that facility when even you reopen the facility. It has such an effect. So we must not go there. We must be able to prepare. I'm just looking at the case where maybe one of us get infected and you're working in Kenyatta or in this referral facility, and you keep on moving around with the inpatient. And the other thing, you are also involving the other staff who are there. And a bigger facility, you'll take, like if I was present for 14 days, all the staffs who have been present for 14 days, a majority of them will have to be quarantined.
Absolutely.
So will you close the facility? So we are saying consider using a half of the staff in every facility so that they can exchange the rota within a specific time so that they do not have to be exposed, all of them the same time.
Is it even happening?
It's not happening. And the other thing we are saying is that we need to consider, the government has announced that they are going to employ. Let us not wait until it is too late. Let's employ the people immediately. Let's give them the requisite training for them to be ready to tackle the menace. The other thing we have recommended within the hospital, let us try and segregate patient. This is to mean when patient come in, at the entry, we must be able to assess who has the flu-like symptom. Let them be seen aside, away from other patients. And we are saying if the government is able, all patients coming in, because some of them could be asymptomatic, should be given mask. So that we avoid also our hospital to act like breeding agent or rather an incubator for the disease.
Okay, so just hold it right there. Let's listen in to Mutahi Kagwe and what he had to say about PPEs, because it's been a concern nationwide about just the frontliners who are the medics. Listen in.
We will not expose our medical workers. And at the moment, anybody facing any patient, any suspect, anybody going to do any tracing is in medical gear. The shortage, of course, the global shortage of PPEs has also been a problem for us. But I am also glad to say that probably by end of day tomorrow, we are also going to start manufacturing PPEs here in Kenya.
Well, it's hopeful that indeed we might start manufacturing PPEs here in the country. But again, look at the time the PPEs are being manufactured. Yes, it's good news, but Hadija, coming to you, you see, the medical personnel are very important to us right now. I think the government is realizing that how important they are to us. That's why they are actually being employed afresh, let's say new entrants coming into the medical scene. But do you think it's too late now? Or maybe it's time now to kind of fill in the gaps?
I think it's a bit too late, but again, depending on the issue that we have, it might not be that too late, because you also need a lot of personnel to kind of assist in being able to handle this issue when it is still has not spread to so many places and to so many people. But again, when you're telling us you want to start manufacturing, when is that? I think this is not a matter of we are about to start. It should have started immediately, because here we are not gambling. It's not about a game of gambling. This is a matter of life and death. So we need to action things very fast. If this is what is needed, is PPEs, then I think the government should have started it immediately so that they can protect our health workers. Again, about the training of our health workers, you're saying you will not expose them. These people at some point will have to be exposed, because we are relying on them. The first contact of a person who is sick will have to come into a contact with a health worker who will now assist you. If this health worker is not protected, then what happens next? Let's not even go far. The issue of Ngara Hospital, where a doctor, like I think is one of his colleagues, who just got that disease from another patient who came in. How many people has that doctor interacted with before they actually came to know that even the doctor himself is positive? So this thing is just spreading from one person to another personnel. So I think the government should act very fast and stop giving us this you know, like they are still not decided on when to start. They are slowing down. There are things that you can't slow down, especially when it comes to life and death.
All right, so much to talk about this case of COVID-19 here in the country, but we're now taking a short break once again right here. But when we come back, now we'll be touching base on matters, landlords and ladies, and of course association, telling the government that they are willing to actually give a breather to their tenants for 3 months as long as the government does something. All that coming to you after a short break. Stay tuned. All right, welcome back to Tipping Point. And of course, it's early in the month, and by 5th or so, you're expected to pay your rent. And the association has come out clear to say that they're willing to give you that breather for 3 months as long as the government does something. Compensation is the game here. But many feel that these are just PR gimmicks coming in during these hard times. If you have a loan, the Central Bank of Kenya came up with directives that you can go talk to your relationship manager in the bank. They can extend it to a period of like maximum of 1 year. Microfinance banks are coming up with directives whereby you can pay your loan interest-free, something that is actually giving Kenyans that time to breathe during this difficult COVID-19 season. But looking at this situation, Bwana George, and you know, rent issues, it's something that indeed it's a long topic, I can say. But you see, this is something, it's an obligation. Every 30 days you have to do something. But this time around, some people have lost their jobs. Some people have been told to kind of take salary cuts. What do you think about now the government in this situation?
It is very clear that once we take any step, including what we are calling the curfew, when we want to do it, we have to understand there are measures that we need also to put in place. And of course, when we are now under this situation where we are asking people to work from home, and a majority of the small business have been closed, even the bigger businesses have now closed down. It is very clear that majority of the Kenyans have got no income. So the government need to caution their people, because again, we have to outlive this situation. If we have to outlive this situation, we must put mechanism and a system that can actually caution our people and ensure that we are moving out. Look, a majority of Kenyans, more specifically the Nairobian, who are over 8%, are living in rental houses. So, and a majority of those people now do not have active income. So what are you telling them? If you have to tell them to do 1, 2, 3, like now we are saying they should not move home, I saw some people were picking their things and going home.
Yes.
Because what am I doing in Nairobi? My business is not working. I'll have to pay the rental at the business where I have my business,
Yes.
and also where I sleep.
Yeah, sure.
So if I'm not able to generate any income, then I have to find a way where I can have a soft landing. That is by moving maybe out of Nairobi or going back to home, and which it has a very big impact. So for the government to come up, and of course I want to applaud what the association of the landlord was saying. We need to say the government, and even more specifically the National Assembly, need to come up with the legislation that can caution them, so that when they are cautioned, they can easily caution the other people. And I want to applaud one of them who I saw in Kuru, Mr. Muridi, who actually cautioned his business rentals and said for this month, no paying. And that was a very good gesture. I think it should implore many others to say so. Okay. And it doesn't mean that he doesn't have any other maybe loans to care for. Lastly, let me say this. Every steps that we need to take to cap the spread of this disease has a ramification. Okay. And when you want to take any steps to do that, must put the caution in place. Okay. And you'll see the American have set aside $2 trillion to caution their people,
yes,
and also to ensure that they are supporting the health workers to ensure that they are able to cap the spread of the disease. Okay. You saw what the Chinese did. We are not far from that. The government cannot run away. We must ensure that the government is taking the first responsibility. Okay. This is where we need to streamline and centralize our politics, centralize our decision making, centralize our coordination, so that we can be able to tackle the issues of COVID-19. Okay. Lastly, let me, before you move, because you have seen the ministry announces something, the Council of Governors are announcing something. Yes. This should not happen. This is the time where we need to approach this from one center. Yes. The WHO have taken center stage to ensure that it is leading the world on what we need to do to curb this disease. We cannot seem to be different here in Kenya. Yes. Yeah.
Okay, interesting. So, you know, when you talk about the issue of landladies trying to soften up, it can be taken into different perspectives, and so many people in Kenya are waiting for that to happen. But let's just listen into association. They had to say this yesterday regarding to the issue of rent paying.
We urge President Uhuru Kenyatta to consider, if possible, he should impose a complete lockdown, except for essential services. Because if the measures we've taken are not reducing, then it is wise and fair enough to escalate tough measures to save more lives. Mr. President, this will require requisite preparations that are logistically effective and legal in nature.
There should be a waiver for rents for the months of April, May, and June, so that this common wananchi can actually work on putting food on the table. That the government should come up with a compensation package for the landlords. Now, we know very well that most landlords are actually servicing their loans, and they depend on the rent for them to service their loans. Now, what we are saying is this. The government should come out and give them a 6 months moratorium so that at least they can have that humble time also to put food on the table.
Yeah, obligations thick, very thick for Kenyans. And Dija, the proposals are clear, but do you think the government will come in and support the association? Because now they just want the assurance that indeed we will support you. Please soften up on Kenyans.
Again, that when it comes to government and the issue of COVID-19 and about rents is not an option of the government will come in. Is if there's a must, they must come in. For any lockdown to happen, it's just a must. Yeah. For them, it will not be an option. But again, as the landlords, ladies and landlords, I think they need to be human enough to understand we are in this fight together.
Yeah.
And it's time for you to show humanity.
Okay.
To just go out of your way and say, you know what, I can survive with 3 months, guys not paying either 3 months rent, and let's see what will happen next.
Yes.
And even the government now can, I've had like, you talked about compensation again. How sure are we that the government has that money to give to all the people who have rental houses?
Absolutely.
I mean, there are people who are having a lot of rental houses out there. So again, we're not sure if the government has that money.
Yeah.
So to me, it will be all about humanity to people who have those rental houses to just go back and say, you know what, I just need to do this, not only for me, but even for my country.
Absolutely. All right. So we saw Brenda and that is Brian coming out as recovered patients, and it was actually very kind of a good environment for even the CS, the president. They had a teleconferencing in this situation, and the recovery has brought in some hope. Let me say a little hope for so many Kenyans. But a day also that 22 more tested positive of COVID-19. Now, back to Bwana CEO, because now this is something we can say brought hope in the country. 2 recoveries. But again, looking at the preparedness, we might be talking about 2 recoveries compared to other nations. Italy also has recoveries. But again, looking at Kenya, we have 2. But you're not looking at the bigger picture here. This thing is spreading big time.
Yeah. Thank you very much. COVID-19 is not a death sentence. When we talk about the disease being a pandemic, it is ability to spread very fast and affect very many people. And we are saying when also it is spreading, there are people who are dying. It has now a very big impact, big on economic and also a test to our health system.
Yes.
Which we need to look at it in a bigger way and look at it like our country, more specifically Kenya. There is a clear indication that we have neglected our system. Where now we are being told, if today even one of our senior or government official is affected, they will be treated here. No one will be airlifted out. So this is where we need to test and re-challenge ourselves and say, is there where we missed something? We need to do it. I think when we have these cases being announced that they have come out of this is a big hope. But again, we are saying even outside there are people who have actually come out of this disease, including over 90 years old person have come out of this condition. However, we have been told that these are this is a condition which is targeting 50 and above years, and also those with impending conditions. So what we want to say and tell Kenyans today is that this disease is not a death sentence, but it has a bigger impact. If today all of us get sick, there will be no place for you to be admitted. There will be no health workers to assist you. And that is to mean even those people who will not have died can actually end up dying. So before we reach there, we must ensure that we cut the spread of this disease. And all effort should be geared toward this before the cases goes high. And when we are told about 10,000, I think we should not wait to reach there. Can the government say that, but we are gearing to put these measures in place so that we don't reach the 10,000 prospection. Let me end up by saying, even when we are talking about this, all this prohibition that we are asking the government to do should not be limited even to the landlord, should also be widened. Looking at even the Matatu guys, they were asking that the government should also give cut down the fuel cost so that it can come down, so that it can aid even the Matatu, assist the Matatu to ensure that they are adhering to the orders that we have been given. So for me, I need to say it's a good indication to the country that people have come out. But again, we must get to know that we have a chance to correct the situation and to ensure that we are able to cap the spread of this disease. Because it can be more worse than even the Spain, the Italy, and the US, which have a more established health system. which are working.
All right. So there's some controversy on the recovery also. If you look at the social media pages from Facebook to Twitter, and it's very interesting because now when you talk about Brenda and Brian, for example, Brian said he got the virus after getting into contact with Brenda, who said she had never met Brian until the isolation yet. These ones have been friends for ages. From 2015, they've been friends, and of course, there are pictures on social media. And if her story is true, why so much inconsistencies? And as she kind of bringing some stories about now how they met. Okay, they've recovered, yes, but why the lies? Because we're seeing Facebook posts 2015, so many years ago. And of course, they say they've never met, just met once. Why do you think this thing is happening? It's an interesting situation where many Kenyans are actually raising questions. Are we being told the truth, or there's some propaganda going on here?
No, that is the question.
Yes.
We are all asking ourselves, is it that it is true that Brenda was actually suffering from COVID-19 and recovered?
Yeah.
Or is it a game by the government just to give hope to its people?
Yes.
Because right now, whatever you're saying that is going on social media, there's a lot of contradicting
Absolutely.
stories.
Yeah.
Whereby this person right now being interviewed say this other, then the next time says a different story.
Absolutely.
We've seen like the photos that you've said, these people have been friends. And what is even contradicting most is that Brenda says that she actually met Brian at the isolation point.
Yes.
Then at some point, Brenda goes back and say, he remember Brian coming to the house.
Yes.
So those are two different stories that are not adding up. So we don't know actually where the truth lies. As much as we might want to say it's giving hope to Kenyans,
Okay.
I just think that the government should actually use the proper way to handle such matters so that we are not left in a dilemma of questioning. Because right now, I'll tell you 95% of people who watched yesterday's interview are actually questioning that this is a game by the government.
Another one, Abwana George. Brenda says she was in the US from December 18th, 19th, until she traveled to Kenya via London on March 5th. But again, her Facebook account places her in Kericho County on December 29th. So many inconsistencies right there. And, Kenyans, most of them are saying you're not stupid.
I think I'll not maybe weigh myself very much into that matter.
Okay.
Because we have a way of doing things.
Yes.
I think there is a way I can post while seated here and I say I'm in London. So there is that mix. So I'll not weigh myself into that matter. I need actually to be true to scientific, because currently what we are calling for is that the country need to gear toward the research. Bigger countries are looking on how do we get the first to be the first to get the vaccine, how to be the first to get the medicine. I think this is what the government even should be telling Kenyans. We have done research, we have done 2, 3. Even when these cases have healed, they are not the first one. That's what I'm saying. So we should not actually even take more time on concentrating on these cases. We should gear toward cutting the spread of this disease.
All right. Thank you so much. And of course, Abwana George and Hadija, thank you so much for coming today. And the inconsistencies you've seen on social media about how Brenda and Brian met, yes, we'll be following up on that story for you. But again, some kind of fish information coming out from different quarters that they've been coached or something. That's something the government knows better. But again, all those things will be following up for you right here on our subsequent bulletins. But thank you so much for tuning in today, right on Tipping Point. I'll see you again tomorrow because we have so much to tell you concerning how the government is actually doing to make sure no more infections are being witnessed in the country. My name is Nick Mudimba. Have yourself a good night. And of course, stay safe, wash your hands, sanitize, social distancing, and of course, stay at home. Good night.